emergency departments have been suffering with some significant overcrowding, not just in Dartmouth, but really, I would say nationwide.
So what we're seeing is high volumes, high acuity, high complexity in record numbers, in numbers we've never seen before.
So that leads to a lot of people sitting in the waiting room and waiting hours.
Patients are waiting longer. What that can mean is that their condition deteriorates, they can feel worse, and coming to the ED generally is very stressful for people.
The challenge is that with the constant overcrowding, it makes it very hard to be able to reassess every single person on a very timely basis.
But what we really realized is that people needed to be monitored closer than just having eyes on. Eyes on is just not enough to tell us sort of what's going on internally.
In 2019, the River Fellow Foundation, thanks to a $1 million donation, created this John and Judy Bragg Innovation Fund here at Dartmouth General. I think he fell in love with the innovation culture and what's happening at Dartmouth General, inspired by the possibility of starting with ideas here in Dartmouth that could one day move across the province and reach every hospital in Nova Scotia. And building on that, they wanted to provide all of the staff, whether it's the doctors, nurses, porters, anyone here at Dartmouth General, an opportunity to bring forward ideas and help fund those ideas to bring them to life. It's a great example of philanthropy in action.
So the waiting room care provider was one of the things that we did put in place. That was the first step. The second step was to implement wearable vital sign monitors. They're small devices that are attached to the patient's wrist and finger. They connect remotely to a monitor that the waiting room care provider monitors, and they can see any changes in the patient's heart rate, blood oxygen levels, or their breathing rate. This allows them to intervene very quickly if they see that something is changing in a negative way.
If there's a change, you can immediately go to that patient. Maybe the numbers changed because they just shifted or they got up, or maybe something has changed. And so then you can bring them into the treatment room, do a more thorough assessment, and then determine, are they well and safe to go back to the waiting room, or do they need to make arrangements to find a space in the ED urgently?
So we have had 100% patient satisfaction with the wearables. Every patient that we have surveyed indicates that they feel comfortable in the waiting room with the level of monitoring that they're receiving, and they also feel comfortable and safe with respect to the concern that brought them in while they're in the waiting room wearing this wearable. We have also caught numerous breathing issues in patients as well as heart issues in patients. When we implemented the wearables, one of the objectives that we wanted to impact was staff satisfaction. And we have also had 100% staff satisfaction with the wearables. They feel like they're able to give better, higher quality care and intervene sooner.
When you have 15, 20 people in the waiting room and you have one empty stretcher, how do you determine who's the best person for that very, very precious resource? I just think this has such a massive potential to really go to any ED, whether it's a large center or a smaller center throughout our province.
We're so proud of the innovation culture at Dartmouth General. It's really a living lab. Innovation is promoted here at every corner of Dartmouth General, and it's really the team that brings these innovation ideas to life, new ideas that can really help advance patient care.
Innovations are imperative to keeping up with the challenges that we're facing in healthcare right now. And in order to meet the needs that our population has, it is going to require innovative thinking and innovative solutions.
The reality is, without this generous donation from the River Fellow Foundation, we just wouldn't be able to move this from an idea to a reality.
On behalf of the Dartmouth General Hospital and the Emergency Department team, we want to extend a huge thank you to the River Phillip Foundation for this very incredible donation, allowing us to advance care in our emergency department for our patients.
I can't wait to see what's next, what's coming up next in the next few years. Idea after idea. You have the team excited. This John and Judy Bragg Innovation Fund is making a big difference. Thank you from the bottom of my heart. Thank you for your support.